Hi, I'm Jason, and this is Matt, and we're both from Wieber Physical Therapy. We've been talking a lot about the shoulder lately as colleagues, and we just kind of wanted to review all that information to maybe give you guys an idea of some things we usually see with the shoulder and how we can work with it. So Matt, what's one diagnosis that you treat a lot with the shoulder?
One fairly common diagnosis I see is frozen shoulder adhesive capsulitis.
Oh, I've heard about it.
Yeah, so once you swing around the front, Jason, and I can demonstrate what that typical patient might present with. So the primary limitation is going to be range of motion when it comes to a frozen shoulder. So, you know, if Jason was going to raise his arm up, you might get to here to be like, you know, I just can't move it any farther.
It's just stuck.
Yeah.
It's frozen.
Yeah, it's frozen. It could or may not, you may or may not have pain with it. And well, you typically are going to be pretty strong, right? Mm-hmm. All right. So why don't you lay on your back here? So some differences here. So if I take Jason's arm through some motion, and before, let's say he went to 90 degrees, and he's like, you know, he wasn't able to do that on your own. Mm-hmm. But now I take your arm up, and he can get full range of motion through multiple planes. I'd probably rule that frozen shoulder diagnosis out, mm-hmm. right? A typical pattern is going to be tight with rotation, these two movements, pretty significantly. All right.
We probably wouldn't be able to even get that much.
Probably not, but you're nice and flexible. Okay. So, a typical patient, research probably is going to be a little more your female, 40 to 50. Sometimes it can be some menopausal things going on there, but otherwise, it can be kind of an insidious onset, but can have a little bit of trauma that kind of starts this irritation.
It sounds like you don't really know exactly what causes it. It just kind of happens. We know some risk factors, maybe.
That's right.
That's the trauma or the menopausal changes, hormonal changes.
Right, right. So that's kind of basic for that one. The main limitation, like I said before, was range of motion. And obviously, if the range of motion is limited, then they're probably going to have some functional limitations, right? Yeah. Putting their arm in and out of jackets and coats and stuff like that. But that's kind of, in a nutshell, for the frozen shoulder. Yeah. What kind of things do you see?
Well, I kind of like working with the rotator cuff injuries.
Okay.
Yeah. A lot of people call them the rotator cuff tears, but honestly, almost all of us probably have a little bit of a rotator cuff tear in there.
That's right.
The prevalence of rotator cuff tears is crazy. It's almost everybody does.
Yeah. Right.
But most of them are asymptomatic. So what we have to work on would be the symptomatic ones, or the painful ones, or the limiting ones.
Makes sense.
It's kind of the opposite of what you were saying with the frozen shoulder. The frozen shoulder is just really stiff and strong. The rotator cuff is usually pretty flexible, but pretty painful.
Yes.
Weak.
Yeah, I've seen that.
Yeah. So what we work with would be really specific tests. We try to isolate one or two muscles and see what kind of strength it has. So a really quick and easy one would be with like a speeds test, where I come out right in front here, and I just put a little resistance. Ooh, and that would hurt quite a bit.
Okay.
Or even just having pain down at neutral down here. Right? It's not exactly a rotator cuff test, but if you're weak in the rotator cuff, I would just be able to just push it right to your tummy.
Yeah. Typically, you're grabbing the shoulder or something like that.
Yeah, making faces.
Yeah.
Maybe some naughty words come out, stuff like that.
Okay.
Right. One in the literature would be like the strap arm test. We don't use it a whole lot clinically, but like if I hold it there, right, if you have weakness in the rotator cuff, you would kind of drop your arm.
Okay. Right? Sag a little bit.
Yeah. If I just let go, you would probably just fall.
Oh yeah.
Yeah. But that would be more for like a complete tear, and we don't see that a whole lot.
No, that's pretty noticeable.
Yeah, pretty noticeable. The big thing is deciding whether or not we want to have surgery with them. For a lot of times, we don't really need a surgery. So what we do is we give it a couple of weeks and it progresses. Right. So we don't need any intervention. But sometimes if it doesn't progress, well, that's what we would go for, like the MRI or the image.
So you're thinking that the stuff that we typically see here at Wieber Physical Therapy and other clinics is more like those partial tears. Like they just kind of start to get
things that just slowly wore out over a course.
Degenerative.
Yeah, over a course of a few years.
Yeah. If you have a shoulder impingement, which is usually some type of mechanical block there, whether it's the soft tissue, the tendon or a burst or something like that. If that goes untreated and gets worse, well then that can slowly kind of fray and end up being more of a rotator cuff pathology.
Yeah.
But, you know, whether it's your high school athlete, you know, diving for that football, lands on his arm, pushes it up, and he squishes some tissue. Yeah, that's not feel so good.
Kind of like Byron Buxton did too. He stumbled to that injury.
Right. So typically they might have some range of motion restrictions. So you're like, oh, I can raise my arm in this plane, right? But then I ask them like, okay, what about out to the side? And they're like, oh, they get to a spot and they're like, ah, it just doesn't feel right. It feels like something's pinching me.
Okay. Yeah, there's like a painful catch there or something. And
for a tall guy like you, I'd probably have to get on the stool. But yeah, so then I would do some strength testing to isolate and see if there's a muscle component there.
Trying to get the specific.
Yeah, right. So once you hop up here, and just once you sit. One simple test, impingement, is we're just going to see what happens when I kind of squish the tissue. So if I was going to bring your arm across your body and I was just going to rotate it there, so I'm making that ball right up a little higher and I'm touching some things. And if those are injured, it's going to be sore. Okay. So really that subjective stuff, their history, right, is going to tell me, you know, like the drop arm thing, the range of motion, functional stuff. That's going to tell me a lot. Yeah. Sometimes you just get some funny, substitution patterns, let's call them.
Oh,
right? Sure. So let's have you face away from me. So a substitution pattern that might lead to some impingement is, let's say, so we're looking at your left arm, and you start to see or feel some discomfort right about 90 degrees. You might think, well, I can get my arm up higher if I use that. Yeah, there you go. You're using your upper trap. And so those are things that we're going to try and correct, so that we can get around that impingement.
Yeah. Trying to restore that normal movement like that. Cool.
Okay.
Cool. Yeah, nice. So the cool thing there is it sounds like we don't really need a lot of imaging with the shoulder.
Typically not.
We can kind of diagnose the tissue and get to the problem with more of these functional exams and the objective measures.
Right.
Yeah. The imaging might come on more if we can't make progress. Right? We want to pursue other treatments. That's when that imaging would come into play.
Right.
Cool.
Okay, so now we figured out we got this patient here.
Yeah.
And we know we want to work on it, but now what are we doing?
What are we going to do about it?
Yeah.
So one thing we could do would be like some manual therapy or maybe some hands-on techniques, right?
Okay.
So if we were trying to get, like let's say that stiff shoulder, that frozen shoulder, why don't you hop up here, we can stretch that.
Okay.
We can stretch that, yeah, on your back.
Okay.
With like some joint mobilization, so we can get kind of close to that end range. Maybe put a little pressure here, right? And then get some of that right there, nice. You can kind of feel that tissue hit a point where it doesn't want to go.
Right.
And we can stretch it right there.
Sounds good.
Maybe get a little oscillation.
Okay.
We could change the plane, kind of come up here, hold that scapula down, get rid of those compensation patterns. Okay. And do some internal rotation.
See how that would help.
Yeah. So that's how we would stretch it. What about strengthening it? What would we do to strengthen it?
Right. So strengthening, home exercise program, that's going to be another big thing.
Sure.
So whether it's range of motion restriction, things are tight, we're going to stretch them, right? If they need a little assist, let's say they're going from your rotator cuff stuff, and here we go. We got the pulleys, right? We do something like that to help get some range of motion back. When it comes to strength, sometimes we just got to work on the weak areas so they don't substitute.
Yeah, sure. Like that classic sideline one. Almost everybody does one of these.
Yeah.
Right, coming up here, hitting that thing.
Yep. So we're gonna what's your rotator cuff? For the throwers, trying to decelerate, slow that arm down with baseball. Yep. Cool. And then another thing that we touch on and we're going to work on is we talked about a little bit, but those functional kind of movement mechanics, posture, right?
Yeah. Okay.
So if I'm sitting in class all day and I'm slumped like this and my shoulders are forward, yeah, right. We don't got much motion, right? There we are. Can't get as high as Jason, but yeah, great. I got to need on the stretching point.
That looks good.
So
yeah, so we can retrain our body how to move again, trying to restore that normal function and normal movement.
That's right.
Or get rid of those compensation patterns. Maybe get rid of that stress that's associated with the pain too, right? Because that stress is going to make me, it hurts, so I don't want to do it.
Yep.
If we can get rid of that stress, then it's going to restore that normal movement and probably get rid of the pain too. There's all sorts of things, right?
That's right. That's right.
Yeah. So in other words, we have a pretty good objective test that we can find out what's going on with the shoulder.
Yeah.
We have some pretty specific things that we can do to help get rid of it.
Mm-hmm.
And then really there's so many different tools that we can do that we can help just about anything.
Yeah, I mean, we could go into, there's so many things that we do that are not in this video when it comes to taping techniques for the posture and the dry needling. I mean, we could,
maybe some of that electrical stimulation.
Oh, yeah.
Muscles to kind of shock a little bit. Get those things to contract.
maybe a different video.
Yeah, different time.
All right.
Different time. Well, thanks for hanging with us. And if you have any questions with the shoulder, we'd be happy to come and see you guys.
Yeah, Wieber Physical Therapy, 507-333-2986.
Hey, there you go. Awesome.